Hi everyone, I will be presenting the synergistic role of peptides and bioenergetics in optimizing cellular health and longevity, a functional medicine approach. My name is Dr. Ilka Tamar. I'm a PhD doctor in natural and functional medicine and wellness synergy, and this is going to be the 14th global webinar on traditional and integrative medicine. Bioenergetics and peptide protocols, health for a long life. We're going to be exploring the science behind bioenergetics and peptides for longevity. Then the objective is going to be to demonstrate how peptides and bioenergetics can work together to improve health outcomes, the importance of personalized approaches in extending longevity, to highlight the practical application of peptides and bioenergetics on everyday health, and to provide insight on how can these methodologies and modalities be integrated into standard healthcare and wellness practices for enhanced longevity. So, in this presentation, we're going to be exploring both bioenergetics and peptides, and my focus was on the longevity enhancement. So, bioenergetic for optimal health balance that will be included on the harnesses the frequencies for improved wellness and energy alignment, and the peptide protocols for personal wellness, unlocking the synergistic potential through tailored peptide protocols, and how both of them work together. As I was explaining, we're going to be exploring bioenergetics and peptide for longevity enhancement. We're going to be seeing the bioenergetic overview, how to utilize frequency to promote overall well-being and balance, how to utilize peptides at bioregulating molecules acting as signaling agents with body's endocrine, immune, and neurological system, how they both actually help with longevity. We're going to be exploring strategies to increase lifespan and improve quality of life and enhance health and wellness, and integrating both of them, the bioenergetics and the peptide for personalized longevity solutions for clients and patients. This is a quote. I like to create quotes. So healing is not just about the body; it's also about restoring the body's energy field to its optimal resonance. That's my personal quote, and I have been working with bioenergetics and bioresonance scans for 1 year now, and I think that everything works together in that synergy. Um, this is a PEMF. Also, that I also work with clients. And then some keywords: bioresonance, which is a technique that uses biofeedback of electromagnetic frequencies to treat, or I would say predict various conditions or illness, longevity, length and quality of an individual's life, cellular health, optimal function of cells, essential for overall health, personal medicine, which is, I would say, is the best. Personal medicine is the best way to actually work with clients or patients. It's about customizing healthcare based on individual genetic profiles. Peptides, short chains of amino acids that act as signaling molecules, regulating biological processes. Sorry, I was sick last week. Cellular resonance, the natural vibrational frequency of cells that can be optimized using bioenergetic therapies. Some methods, so I use both. I use a comprehensive review, which is I conducted extensive review, cover scientific studies, research paper, abstract, clinical trials related to peptide and bioenergetics. I focus on the latest advancement methodologies and findings, and I also include a case of studies or patients and clients that I have been working in a clinical setting and on my personal practice. The clinical applications investigated how peptides actually therapy enhance cellular repair and longevity, and evaluated bioresonance therapy ability to detect and correct energetic imbalances. So let's start with the principles of peptides and bioresonance. Peptides, with what they help: regulate hormones, immune response, and metabolic functions, improve tissue repair, inflammation control, and cognitive functions, use it as an anti-aging, chronic disease management, and functional medicine. Bioenergetics It uses frequencies to detect disharmonies in the body or imbalances, works by realigning energy fields and optimizing biological functions, enhance detoxification, immune response, and metabolic efficiency. That's some of the things that they do. Actually, I have worked, as I was mentioning before, 1 year with bioresonance and bioenergetics, and it's a lot of things that they you can see and do for your clients. What are peptides? Peptides are bioregulatory molecules acting as a signaling agents within the body's endocrine, immune, and neurological system. Unlike proteins, which must undergo extensive digestion, peptides are smaller, easy to absorb, and can exert targeted effects on a specific tissue. So this is what I love peptides. I also have been working with peptides, I would say, since last September 2024. And I will be through this presentation showing you two cases on how using both of them you can get great results. The key peptide functions. Are some examples: the growth modulation for CGC1295, ipamorelin, GRPI6 for growth hormone. I have seen great improvements in the growth hormone signaling with peptides. Also for tissue repair and regeneration, BPC 147 for gastric healing, TB 500 for musculoskeletal repair. BPC 157 is I would say, my first peptide I work with clients. I would say 90% of the clients that come to my practice have digestive issues. Neuroprotection and cognitive enhancement. That can be Semax, Salang, Dihexa for neurogenesis and synaptic plasticity. Um, and immunomodulations like thymosin alpha 1 for enhancing T cell function. Recent clinical trials have demonstrated that peptides' ability to regulate epigenetic expression, modulate inflammatory pathways, and improve mitochondrial function. You can check that on the Journal of Peptide Science. What is bioenergetics? Well, bioenergetics studies how energy flows and is regulated within living organisms, influencing cellular function, communication, and overall health. At the core of bioenergetics is understanding that all biological processes are governed by electromagnetic and vibrational frequencies. All of them is going to be regular cellular communication and physiological balance. Key aspect of bioenergetics: mitochondrial energy production, ATP synthesis through oxidative phosphorylation and electron transport chain functions. Cellular resonance and electromagnetic fields, that's the BEMF, how vibrational frequencies influence biological coherence and cellular health. Bioresonance therapy, that's the most that I work with, is a non-invasive method that assesses and corrects energetic disharmonies by detecting and modulating frequencies at a cellular level. Redox biology and energy homeostasis is the role of redox signaling molecules in regulated metabolic processes, detoxification, and the immune modulation. The bioresin therapy is a great, I would say, modality and a key application of bioenergetics. It will be identifying and correcting electromagnetic imbalance within the body and at the cellular level by using frequencies-based technology to restore energetic harmony and optimize physiological functions. Recent studies suggest that dysregulated bioenergetic fields contribute to metabolic disorders, neurodegenerative disease, and immune dysfunction, making bioenergetics a fundamental aspect of functional and integrative medicine. And you can find more of this at this reference. Um, this is the most I would say, interesting part: why we want to combine peptides and bioenergetics. In my personal experience, I have seen like it's a lot of things to get the client to this point that they're balanced, that they're feeling better, they have less symptoms. And I try different approaches, like I'm also a health wellness coach, and I also do homeopathy. So I don't use only one approach. I try to see what we call personal medicine, what actually will help the client personally on his illness. So in this case, I normally try bioenergetic tests first. I see what is imbalanced in the body, and then I decide what peptide protocol plus anything else that is herbs, homeopathics, supplements, or anything that the client actually needs. So peptides and bioenergetics complements each other by working at different but interconnected levels or cellular physiology. Biochemical repair peptides and energy optimization bioenergetics is going to be resulting on an enhanced therapeutic outcomes. Example of this synergy is a neurodegenerative condition, SLAC, which is an anxiolytic peptide, plus bioresonance therapy for brain frequency enhancement, and it has some great results with that. Musculoskeletal healing with TB500 plus the pulsar electromagnetic field PEMF that I mentioned before, therapy for improved musculoskeletal repair. Metabolic disorders, MOTSC, mitochondrial derived peptide, plus a red light therapy for mitochondrial biogenesis. So either I use bioresonance, I use PEMF, or I use red light therapy, depending on the case, depending on the client, depending on the access they have to these modalities. So I play with that. In clinical studies, this dual approach has been shown to accelerate recovery, reduce oxidative stress, and improve energy deficiency. You can see more reference here on the integrative medicine insights. The synergistic approach we were talking about, like how they actually work together. Benefits of this synergistic approach. So, in holistic health, addresses both biochemical and bioenergetic aspect of the well-being. It also provides a comprehensive multi-layer health strategy. So we go very deep into the root cause, but also we go deep into what they actually need at, would say, frequency level, energy level, cellular level. Increased efficacy, synergistic combination therapies lead to better patient outcomes and reduce patients or clients reduce the risk of disease by addressing root causes at fundamental level and personal care. That this is something that I always enhance in my practice, either when I work on research, either when I work with clinics, or in my personal practice. Is going to be a tailored health plan or protocol integrating the peptide therapy with the frequency based medicine. It also empowers patients and clients with knowledge and control over their health. Okay, more about that synergistic approach because I really love, I would say, the outcomes on both modalities or both protocols together. Um, sorry. Peptides. So they're going to be supporting the tissue repair, immune function, and metabolic balance. They're going to be influencing the gene expression related to anti-aging and regenerative health. Bioenergetics, in this case, I use bioresonance, PEMF, or red light therapy, depending, detects and correct frequency imbalance affecting the cellular health, enhance the body's natural energy flow and healing mechanism. It's going to be the combining effects together, the peptides and the bioenergetic optimize cellular function and longevity, and address both biochemical and energetic needs for comprehensive wellness. And then this is going over again on the personal treatment or personal protocols. We're going to be integrating the peptide therapy with the bioresonance, scanning for tailored health interventions, and provide a holistic functional medicine approach combining biochemical and energetic data. So the bioresonance scan is going to be telling me exactly what is going on in the client's or patient body at the moment. I also use other tools like functional medicine testing, and sometimes the client comes with their own labs, but I always like to go through the bioresonance scanning because I'm seeing on real time what is their energy frequencies are in their bodies. Affecting interventions is going to be giving me more precision treatments and protocols designed to fit an individuals' unique biological blueprint and enhance overall treatment outcomes and optimize health restoration. Why is important? Because if I get the bioenergetic or bioresonance testing, I'm going to be seeing what exactly I need to add on their protocol. That means either peptides, herbs, homeopathics, or anything else that I need to add to the protocols. Because again, this is a personal medicine approach, is not one size fits all, and every client and patient needs something different. Okay. Um, Let me just click here. I got this. Okay. Case studies. This is the first case study. This is it was my personal actually the two case studies were my personal clients. So he just wanted peptide for longevity and to correct different, I would say, symptoms that he was having. He's a 58 years old male presenting some chronic fatigue, poor sleep quality, cognitive decline, and accelerated aging signs. His lab results indicated mitochondrial dysfunction, increased oxidative stress markers, and shortened telomere length. Um, I use also the lab. He got them and he bring them to me, so I use them as well as part of his intake. So intervention, I use epitolone, targeted telomere elongation, and pineal gland regulation. GHQ peptide to stimulate stem cell activation, collagen synthesis, and wound healing. NAD plus in an IV, NAD on the IV therapy. I send him to a place that I have great relationships and is a clinic too. And they provide the NAD IV therapy to replenish cellular energy levels and improve mitochondrial efficacy. He also went to, I would say, it was a series of 10 red light therapy sessions at 660 nanometers and 850 nanometers wavelength that helped him to enhance cytochrome C oxidase activity for ATP production. And of course, the bioresonance frequency optimization. So I work with him with that frequencies so I correct energetic imbalances and affecting his neuroendocrine function and system. So this was his outcomes in a, I would say, 6 month time. Every client is totally different. This one is 6 months. I think the next case is going to be improvement. You're going to see the improvement in 3 months. So sleep quality improvement, increased deep sleep cycles by 25%, measured by polysomnography. He went to a sleep institute to check on that. Cognitive function enhancement, improved memory recall, and executive function. We validated through a Stroop test and MMCE. Inflammation reduction, lowered CRP and IL-6 inflammatory markers on his functional medicine labs, leading to a better systematic recovery. Increased telomere length, demonstrated 5% lengthening in the telomere. So we did again the same test after 6 months to see the difference, and enhance skin elasticity and muscle recovery. Noted visible improvement on his skin texture and muscle regeneration. And we assessed that via dermal scan and muscle fatigue markers. Okay, so this was in a 6 month lapse. I think it was a great outcome. He's still doing some of the stuff. He's still doing the GHQ and the NAD IV, and sometimes he do the red light therapy. And the bioresonance scan, we do it every 6 months. That's the first case. Let me just go to the second case. This is this client came with she wanted to improve her detox and metabolism. She's a 42-year-old female suffering from chronic toxic overload, brain fog, sluggish metabolism, and unexplained weight gain. Her symptoms were linked to impaired liver detoxification, leaky gut syndrome, and heavy metal accumulation. I did some functional tests, which revealed that she had high oxidative stress, of course, hormone imbalances, and metabolic inefficiencies. So, what we work bioresonance scanning. I wanted to see what was going on in terms of her frequency disharmonies and imbalance affecting her liver, gut microbiome, and thyroid, and in general the endocrine system. I work with her the BPC 157 peptide therapy, which is helping her enhance her gut lining integrity, reduce inflammation, optimize nutrient absorption. Because that's another thing. Sometimes clients come to you or patients with a lot of supplements, vitamins and stuff. But if you don't um, heal the gut lining, you are not going to absorb none of those. Also, we work a frequency specific microcurrent therapy targeted for the lymphatic drainage and similar liver detox pathways. I sent it to a specific person that I work with. She's a massage therapist, and she worked with that. Um, I added a glutathione supplementation to increase cellular detoxification capacity and neutralize oxidative stress. And then we also work at the molecular hydrogen therapy, reduce her reactive oxygen species burden, and improve mitochondrial health. Outcomes: she saw her symptoms getting better in just 3 months. So, cognitive clarity and mental energy. She improved her brain fog symptoms by 60%. That's a good number. Validated through a neurocognitive testing. Liver function optimization. She reduced the ALT and AST liver enzymes markers, indicated improved hepatic detoxification and bioflow efficiency. Metabolic efficiency gains. We lower the HbA1c levels, increasing the insulin sensitivity, improve the body composition metrics. That was a big issue for her. She was going pre-diabetic, and we work on that. We also have the microbiome balance, decreased gut inflammation, evidenced by a 50% reduction in sonulin levels and improving the SCFA, which is the short chain of fatty acid production, and also increased energy levels on her. We reported 40% higher energy levels correlated by the VO2 max testing and ATP synthesis biomarkers. So in 3 months, we got that. She now continues doing it every 6 months. She's still using the BPC 157, and we do the bioresonance testing every 6 months. She's still using the glutathione as well. So um, that's the two cases that I wanted to discuss. So future directions, the integration into healthcare, so incorporate bioresonance and peptide therapy into standard medical practice and wellness centers as well, hence the patient and clients outcomes through personalized functional medicine. More research and development. I think that first students need to validate the synergistic benefit of peptides and frequencies in the frequency medicine and advancement in AI-driven bioenergetic diagnostic and customized peptide protocols. You know that everything now is moving AI. I think that maybe adding the AI to this bioenergetic test is going to be improving the client's outcomes. Public education, increasing the awareness of frequency based medicine and peptide research, and promoting acceptance and understanding of personal health solution in longevity medicine. Conclusion. This is my conclusion. Peptides repair and regenerate cells, while bioenergetics optimize energy flow, creating a synergistic healing model. And I previewed two cases. I have more cases, but I just wanted to discuss, I would say, the most interesting cases that I have using both modalities, which are bioenergetics and the peptides. The integration of peptide therapy with bioenergetic medicine offers a multidimensional approach to longevity, cellular rejuvenation, and functional wellness. By addressing health at both of biochemical and frequency based level, this methodology allows for deeper restoration of mitochondrial function, cellular communication, and immune regulation, and clinical evidence supports the role of peptides in reducing oxidative stress. Everybody suffers from that, enhances telomere maintenance, and promotes systemic repair. Meanwhile, bioresonance therapies aid in restoring energy homeostasis, optimizing metabolic pathways, and mitigating chronic disease progression. This integrated model not only supports healthy aging but also provides preventive strategies for neurodegenerative conditions, metabolic imbalance, and immune dysregulations. As personalized and precision medicine continues to evolve, incorporating bioresonance method-based intervention into standard medical practice and more wellness center will enhance the ability to detect, prevent, and revert dysfunction at a cellular level. The future of functional integrative medicine lies in leveraging both molecular and energetic modalities to redefine longevity and optimal health, making a way for a new paradigm in holistic science. And these are my reference. I'm just gonna leave them here in case you want to check them out. Leave it maybe 2 minutes that you can see it there. And that's it. Thank you for the opportunity, and I hope you enjoy my presentation.